It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're now bringing you today's briefing from the South Korean health authorities. We'll be getting the latest figures as well as updates on any measures the government is taking. The number of new cases was back above 100 today. Let's listen in.
We will also have Mr. Yoon Tae-ho, the head of the Central Disaster Management Headquarters, and Mr. Pan Chul-han from Ministry of Diplomacy present today. And we are also providing sign language translation. We will first hear from the Minister Bang Neung-hoo. I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. As of midnight of today, there were 118 additional confirmed cases for the community spread. So there were 39 in the non-metropolitan area and 79 in the metropolitan area. One person passed away yesterday. We pay our condolences to the family members and the deceased. It is inevitable that we will be staying with COVID-19 for a long time. And in order to coexist together with COVID-19, we have reformed social distancing measures, and it has been in place since yesterday. This reform is based on the opinions and the knowledge that we have accumulated until now. And it is also considering the medical care equipment and facilities that we have in place that have been confirmed. So in consideration all of that, we will also have various types of assessments on the risk level, and this will be assessed differently by weekly levels. I will now explain about the new type of assessment. Considering that the risk is spreading quite fast, instead of the 2 weeks that we used to assess, we are shortening it to a 1-week period, and we are going to make the announcement. And for the imported cases, they are usually found in the quarantine stage or during the self-isolation. So it is actually lower in terms of the risk with community spread. That is why it won't be included in the community spread cases. And also, for the daily average of the newly confirmed cases, we will also consider whether we can provide sufficient treatment to our patients. So, including those patients who are over 60 years old, we will also look into whether we have enough hospital beds or not. So, we will be announcing that on a weekly level. And we thought that across the country, it is better that instead of taking a unified level of measure, it would be better that it is divided by each region. So we will be looking at key indicators based on that. Now I will update you on the assessment for the past week. In level 1 social distancing, if the social activities are to continue, we will be maintaining the current level of high number of newly confirmed cases that we have seen in last week, and it was around 87.3 last week, and against the 82.9 of the previous week, it was a slight increase. And for those who are over 60 years old, the average level is around 25.8, and the government is trying to maintain it at less than 100 newly confirmed cases and less than 44 people who are over 60 years old. And this is the target that we have set. And considering that the number of confirmed cases is continuously increasing is a risk for us and is a concern for us. Especially in the metropolitan area, we are seeing a daily average of 65.3, and for the Chungcheong province, it's at 14.1, while for the rest of the regions, it's at less than 5 people. For the critically ill, it is being maintained at 50, and for hospital beds, where people can be immediately admitted, we have 137 hospital beds, so we have a sufficient level, and we will be able to provide the appropriate treatment to those who are critically ill. For CDC, we are maintaining our control level at a stable level. However, reproduction level of infection is at a level that is slightly higher than 1. This means that compared to our tracing and suppression, infection is ahead of it. especially for the vulnerable facilities, there were some cases, and going beyond that, we are seeing cluster outbreak increasing in our general activities, such as our general gatherings. If we were to continue such a risk, this means that we will have to elevate the level of social distancing in metropolitan areas to 1.5. That is why the government is responding with a very tense sense. In the social distancing phase, it is important for us to suppress any further spread so that we can have countermeasures against COVID-19. We want to ask our citizens once again, in order to suppress this expansion of the infection, we have to make sure that we are following the general personal hygiene levels. In recent cases, there were cases where people did not wear face masks or people had difficulties in wearing face masks, and it was especially risky if people were confined in those spaces that were especially crowded and closed. Please remember that outside of your homes, it is very critical for you to wear face masks. Also, in restaurants and cafes, unless you are eating something or drinking something, or even saunas, unless when you are coming outside of it, please make sure to wear face masks. In the new social distancing level of 1, wearing face masks and making sure to record the visits and ventilation is mandatory in most of the facilities. With regards to this, starting on November 13th with the reformed social distancing measure, for people who violate these measures, such as not for the ones wearing face masks, you will be fined around 100,000 won. Please make sure that this is very important, and please make sure to follow it. Together with the Prime Minister, yesterday in the Hongdae streets, we have promoted the wearing of face masks on site. From now on, to our young citizens and to the rest of our citizens, I hope that face masks will be an item that must be worn. And also, for the government, we will also have extra masks in public places so that people can wear them when their masks are damaged. And together with our citizens, the government is continuously striving very hard. First of all, we are strengthening safety in vulnerable facilities, and we are taking care of preliminary measures. In facilities such as the long-term care facilities, we have continued to do a monitoring. So we have done the monitoring for 1,500 long-term care facilities and 400 mental hospitals and other cases. For long-term care facilities, there were some cases where they couldn't follow the measure because they didn't know about it. And for some of the senior facilities, there were also cases where they didn't have the contactless visits. The government will closely monitor this to come up with any improvements that should be made, and we will also make sure to have continuous dialogues with the local governments. In the metropolitan areas, for all people working in the vulnerable facilities, we will be conducting a diagnostic test. And until now, we were able to find around 30 patients at an early stage in 70 facilities. And we're going to expand such diagnostics to all of the other vulnerable facilities as well. And until the end of the year, for metropolitan area, every 2 weeks, and for the non-metropolitan areas, every 4 weeks, we will be conducting diagnostic tests for people working in vulnerable facilities. It is very important that we treat patients and also reduce the number of patients as well. And in order to do so, we have to strengthen our medical facilities. So we are making measures in that regard. And our CDCs We'll also expand the number of the hospital beds that is for people who are critically ill. So we're going to have more hospital beds assigned in those cases. We're going to have more than 200 by the end of this year. And by next year, we are targeting more than 300 hospital beds for those who are critically ill. Also, for the central hospital, we also have the central empirical study and central clinical studies participating. So we are going to improve the management system so that only those who are critically ill can actually go into critical care. And we believe that by doing so, we will be more effective and efficient in allocating hospitals to the right patients. And in preparation for any massive outbreak, we're also going to have an advanced assignment so that we can immediately operate it. Next is the measures for those who are coming in from abroad, especially for China. Recently, China has seen an increase in the number of confirmed cases. So we are going to strengthen measures so that we have higher measures taken care of for people who are coming into Korea. And also, China has said that they will also have strengthened measures for those people who are coming in from abroad. So for people going to China, if you are going to China, you must be diagnosed within 48 hours before going into China. And also, there would be also cases where you would have to have 2 sets of tests done within 72 hours. So the government wants to make sure that those people who are going into China will not go through any inconveniences. So we're going to have separate individual announcements to make for those who are planning to go to China anytime soon. And to make sure that there are no inconveniences, we're also going to make sure that we are publishing the confirmation letters as soon as possible for those who are going into Korea. And for the diagnostics, we are also thinking about not getting the PCR testing, but doing an antibody testing instead. In Korea, there has been some analysis on COVID-19, and we have seen a lot of announcements on that. When we were to summate those results, there were around 10 to 20% of superinfections, and this leads to community spreads. And it is not that patients have any special characteristics where they are diagnosed for some cases. However, it is that it can happen regardless of the people, whenever these people are placed together in closed and confined and crowded spaces. So it is more related to the crowdedness. So crowdedness and confined spaces is more important in terms of spread itself. So we will have to come up with measures that are in line with such results. And we have done so already, and we hope that our citizens will also follow these measures as they have done until now. So please be careful of closed, confined, and crowded spaces, and please make sure that you are taking care of personal hygiene, such as washing your hands and keeping social distance. Everyday life disease control is very effective in preventing COVID-19, and since we are seeing the result of such studies, please have confidence in taking more care of following these measures on personal hygiene as well. Right now, reproduction of the infection is close to the level of 1. And if we were to take a little more effort and slow down the speed of infection, we believe that we will be able to control the situation at a stable level once again. The government will also continue to strive hard and will make sure that we are suppressing the infection at a faster pace as well. So we want to thank you once again for all the efforts despite the difficulties that you may be facing. So I believe that if we were to respond as we have done now by cooperating where our citizens and the government come together, we believe that we will be able to coexist together with COVID-19. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.